The Addiction Podcast, Point of No Return, sponsored by Narconon Ojai.
Welcome to the Addiction Podcast, Point of No Return. My name is Joni Siegel, and I'm the host for this podcast, and this episode is episode number 209. It's the beginning of our 5th year of weekly podcasts. Now, when a person is addicted to drugs and or alcohol, the myriad of choices of treatment can definitely be overwhelming. Narconon Ojai is a residential treatment facility that addresses the spiritual, mental, and physical aspects of addiction with an evidence-based, holistic, drug-free, proven step-by-step program to free those trapped by addiction. For more information, call 1-866-231-5924. It's an anonymous call. They can help you. Today, we are going to interview sort of the second half of the couple that we met on Super Bowl Sunday at the Sober AF Entertainment party in Tampa. We did an interview last week, you may have heard it, with Katie Sullivan, who, while having her own history of addiction, she worked under President Trump's administration in the area of policy. So today's interview is with a gentleman named Art Kleinschmidt, kind of the other half of that relationship. And Art served as senior advisor on substance abuse to the Assistant Secretary for the Substance Abuse and Mental Health Services Administration, also known as SAMHSA, at the U.S. Department of Health and Human Services. He is also the former deputy director of the White House Office of National Drug Control Policy. In other words, he was a deputy drug czar appointed by President Trump. He has his own history of addiction. He has a Ph.D. He is certified in trauma treatment. He's a licensed professional counselor, licensed addiction counselor, and licensed drug and alcohol counselor. Without further ado, let's talk to Art Kleinschmidt. Dr. Art Kleinschmidt.
How you doing?
Thank you so much for being on the podcast today. And thank you for telling me that going forward, I can just call you Art.
Perfect. Yeah.
So tell us about your drug or alcohol history. How did you get started on drugs? How old were you?
Well, I started with booze. When my parents would go out at night, they actually had a bar, and then we'd have people over and started drinking. I probably was in, say, the 8th grade, maybe a little bit younger than that. Started using, and then sort of the marijuana. My old man was like a very staunch guy. And I didn't like anybody trying to sort of control or manage me. So I always kind of sought out my own sort of independence. And I guess like with a lot of kids, one of the ways you kind of get independence is sometimes through like substance use, substance abuse. And so it was kind of rough a little bit growing up for me, but like sometimes I would take home a report card with all Fs when I was like in 6th, 7th grade, something like that. And then I started hanging around in the neighborhood. I don't know if you want to know some of my story, but I'm
sure. Which neighborhood? Where are we talking about, Art? Where did you grow up?
Well, I grew up in Algiers, which is a section of New Orleans. And then I went to school there, but then they sent me to Catholic school, which didn't meld with too well. I mean, I'm still a Catholic, but back when I was going to school, they could hit the kids and stuff like that. So, but anyway, so I would kind of rebel against that. And then like in my New Orleans neighborhood, there was like this was like in the 80s. They had it was the Funland days. There was an arcade that was called Funland. So if you wanted to be like a little juvenile delinquent, that was the perfect little sort of crime school. So like if you wanted to buy drugs, you could go there and buy drugs. If you wanted to find somebody that can help you break in cars or steal stuff, they would be there. And then the people who ran the Funland were actually a fence for stolen merchandise. So you could, if you stole it, cleaned anybody out, you could shuck it right there and then buy whatever you wanted there. Around that time, Quaaludes, acid, that kind of stuff was very popular.
And did you do all of that?
I did all of that. Yes.
Okay.
Yeah, I got, I mean, it was like, looking back at it, it was kind of, sometimes like it was crazy sort of fun times, uh, uh, but yeah, I mean, it was pretty nuts. I mean, like, you could kind of get in little fights and that, and then you could kind of, little juvenile delinquent type of, crimes with everything.
Got it. Did your parents know about your
Well,
activities?
well, they got clued in because, I mean, I did like, I'll tell you some weird story that just occurred to me. Like, one time I was out late at night. I was still probably a juvenile. I used to sneak out of the house at night. And then I was with my buddies, we were breaking into cars, and for some reason, I didn't even know what I was doing. But like, I ended up with some equipment. This is like in the '80s, and they had the car phone and all that stuff. And so, like, I had this stuff that you could tell was just totally ripped out of somebody's car. And then I remember, I don't know why I was thinking this, and I went to stash it, and I stashed it in my old man's bathroom. So like, I wasn't thinking right. And then like the next day, like he's calling me down when he found it, and it's like, and he's questioning me about all this sort of merchandise and how it got there. And of course, well, I don't know. And he would say, well, think. And I'm like, okay, I pretend like I'm thinking, yeah, I just don't know where that came from. But and there were other things like that. Like I
That's
said,
a good story, though. I like that story. How old were
oh,
you when you did this?
I was in high school, so I don't.
Okay.
Some of that is kind of a blur. I originally failed ninth grade, uh, and then when I failed ninth grade, I used to have to. I went to a place called Jesuit high school. It was very strict. You had to wear like khakis, and then you had to wear these hard black shoes, and you had the name tag. Well, that was really hard for me to sort of abide by. And I remember, and I looked up this kid that I used to hang with back then. We used to go to the local supermarket, and you had these school bags. They were like a vinyl, like a carry. But if you left it sort of half unzipped, it was still sort of closed. So you could take like candy, and you could slide it into the unzipped portion, and you can kind of go and sell it for cheap. And then so we do that and buy weed. And I remember, like, so this was like in ninth grade. Uh, I left school with this kid to do that kind of stuff. And then they fixed it. I don't know if I should tell all my punch in my story, but
Tell whatever you feel comfortable with. I
okay,
don't want to
well,
put you on the spot.
this is one thing. Okay. So we stole all this Pam cooking spray. And it used to be like back in the early '80s that if you spray Pam into a plastic bag, and huff it, you would get like a total like ringing. So I
Okay.
remember like he and I stole a bunch of all that stuff, and we were spraying it in these Hefty's bags that we stole too. And then we passed out in the middle of the neutral ground on like busy street. That was like at Carrollton and Canal, which is pretty busy in New Orleans. And then some people started honking, whatever. And then I remember kind of waking up, and it's these two young Catholic school kids in their Jesuit uniforms. So that's one story.
Okay.
And then it kind of got progressive from there, because the disease of addiction kind of progresses. So
Right.
that's some of my early stuff.
So at what point in your history of addiction did we call the podcast Point of No Return? Like, when was your wake up call? When did you finally go, yeah, I can't do this anymore? How did that happen for you?
Kind of accident. I don't know. I think grace to God, I stayed sober. It wasn't my intention. I could tell you like the episode that sort of drove it, but like, so that was back in the early '80s, what I was just talking about. So
Right.
and I kept using the whole time. I mean, I met with certain sort of success in my life. Some I passed the CPA exam, and which is a whole nother story. But I passed the CPA exam, which is actually sort of tough. But um, my man died in '98. Um, so anyway, so it would have been sort of like the mid to the late '90s, and I know now. At the time, I didn't know, but I know now. That's when all of a sudden these fraudulent pain management clinics popped up all over the city. You
Right.
probably saw some of that, but it was the wild, wild west with these pain management clinics.
Yep.
And then So like, and how they used to do it, they used to call it 90, 90, and 90. So you would get 90 of the pain medicine you liked. You'd get 90, whether you like Xanax or Valium better, you could pick it. And then you get 90 of this very powerful muscle relaxant called Soma or Crispidol. So that'd be, and so if you want me just to fast forward from those days, which I can always describe, but it was New Year's Eve. I didn't eat anything because I wasn't eating much back in the day. I was kind of emaciated. And they used to, like, in New Orleans, they have drive-through daiquiri shops. I know they sort of, people sometimes, I didn't think that was weird. Some people think that's weird. But
I've never heard of a drive-through daiquiri shop. I'm just saying. So that's kind of new to me. Okay.
Okay, but yeah, they had that. So, but there was this other daiquiri shop, and they had these really powerful Long Island iced tea daiquiris, and I would drink multiple of them a day. Like $4 or $5, and you're definitely.
So that was your nutrition. You got a little fruit juice. Yeah. Okay.
Yeah. So it was New Year's Eve. My buddy, whatever, he wanted to go get some ecstasy. So I said, okay. So I went into the place, and they didn't have any. They only had the Soma. So I bought like a whole bunch of those. So I was going to go to my mom. She was going to put steaks on, and I had, at the time, my niece was young or whatever. And then my friend didn't want to do it. He thought I was nuts. So I took like a big handful of them. I took over probably about 10 of them, and then washed them down with my daiquiri. And so I went into my mom's house for the little New Year's festivities, and I went to shoot with my the bottle rockets, and then I remember, like, I felt like this, so I didn't even get high off. The next thing you know, I like just hit the dirt, and then I was kind of like doing some kind of convulsing type of stuff. My friend got scared, so he ran off, and so then eventually my whatever, I was able, my mom and them put me in a bed. So then it was like, okay, so I kind of came through, and then, like, when all the fireworks were going off around midnight, I kind of woke up. And then, so I was like, oh, wow, I'm in my sister's room. So then I reached down in my pocket, and I had still another handful of the Somas. So I took them. And then I went down to say, hey, I'm cool now. That was just a little whatever it is. And then next thing you know, I did the whole episode all over again.
Oh, gosh.
And then, so it was a couple of days later. That was New Year's. Maybe the next day, LSU was playing in the Sugar Bowl. So my mom was like, oh, come over, we have whatever for the LSU game. And then they turned it off. They did like intervention. And then I ended up going up to Minnesota to get clean and sober.
Okay.
That was
what kind of a program was in Minnesota?
Well, I went to Hazelden. And then from Hazelden, I lived in the recovery community. St. Paul, Minnesota has a real big recovery community. I lived in like two different, they call them recovery houses. We call them sober houses, but and I ended up at an Oxford house.
Okay.
I mean, there was a little bit of drama in there. I mean, I got booted out of one. I had to live in like a crack motel, but I stayed sober, and then whatever, Oxford, I was able to get into an Oxford. And then from there, that was probably, I actually look at that level of care, that recovery house, sober house, out of treatment, as one of the most profound sort of recovery aspects in my, or along the continuum, where like a lot of the big changes sort of occur.
Okay. And have you been sober since then?
Yeah, I got sober January 4, 2002.
You are listening to the Addiction Podcast, Point of No Return. For more information on the podcast, or to reach out if you have a story you would like to share with us, go to our Facebook page by the same name, or you can email us at theaddictionpodcast@yahoo.com, or go to our website, theaddictionpodcast.com, or call us at 727-314-7080. And please remember to subscribe to our podcast wherever you listen to podcasts, and give us a 5-star review. For more information on our sponsor, Narconon-Ojai, visit their website at narcononohi.org. That's NARCONONOJAI.org. Or call 1-866-231-5924. That's 1-866-231-5924. Sometimes, the hardest thing about getting someone into recovery is getting them to agree to treatment. Bobby Newman, a certified drug counselor with 30 years experience and an over 85% success rate as an interventionist, has created a series of 12 videos that you can use right now to learn every step to get your loved one to agree to treatment. Call 1-833-918-0008 today and say the word podcast to get a 10% discount. Or go to newmaninterventions.com and type in the word podcast for a 10% discount. This service comes with a free 1-hour consultation with Bobby.
So like
Awesome.
I got sober during the crazy pill mill sort of rage, and at the time I could, it was crazy. I could tell you about it, but at the time I just thought, because I was living in New Orleans, I kept waiting for these places to get raided. They only took cash.
Right.
You know, and then for the longest time, I thought that was just regular New Orleans corruption, you know.
Yep.
It turns out that it was actually federal policy that was behind it. So,
Yeah. Well done. You've been sober 19 years.
I have, yes, for the
That's
grace
awesome.
of God, yes, for 19 years.
Totally awesome.
I was a
So
big AA guy and everything else, so yes.
there you go. So you got clean and sober, and then what happened to your life after that? Where did you go from there? Because you're like a PhD. And you're not a CPA.
Yeah, right. So I stayed in St. Paul. I did this thing, like, you know, they talk a lot about peers, but before like peers were a thing, I actually was doing this sort of service work, and I felt dumb about it. But I got myself into it. I would go, like, I think it was every Thursday morning, the halfway house I went to, they would get their new admits. So it would be like my volunteer job was to show up early in the morning, get the new admits. They'd give me a bus pass, and then like they would make everybody like a bag lunch, get my bus pass to bag lunch, and take all the new admits on the St. Paul City bus, and then show them around the city off of that, bring them to like the Minnesota job fair thing to fill out applications, bring them something somewhere else, bring them over to the AA intergroup, and then bring them. So I did that for like over a year, and you know, I felt like a tool about it, but I got to say, I think that kind of work actually helped me stay sober. And then from there, Hazelden has like a graduate school. They don't have like, they have a graduate school where I went and I studied addiction counseling. Like I had like an MBA and a CPA and that sort of a thing, but I hadn't worked in a number of years. I was just carousing around New Orleans. But so I went back to graduate school, and then I became like a counselor, and then I started working at like an adolescent prison correctional facility was my first job. I did my training, my clinical work at Hazelden on the units. I worked with adolescents and that sort of a thing. So, and then from that adolescent prison, I was recruited to come work at a long-term treatment facility for like hardcore relapse people in Colorado. So
Is that where you met Katie?
That's where I met Katie, exactly. I met her in that treatment center, by the way. It's kind of, I sent her a letter, was actually how we first sort of communicated. But so she came up to me at that treatment center, because I was a clinician there, but they wanted me to tell my whole AA story there at their big speaker meeting. So then she came up to me after I told my story.
Okay, fair enough.
Yeah.
So you then were working at this facility in Colorado.
Yeah, it was very rural, so it's way up in the mountains. So I had to do my PhD remotely, but so I did the PhD while I was working full time. I mean, I worked at a couple different sort of places back and forth. So I worked at different levels of care with different populations. So
okay,
what they work with, I mean, from a clinical perspective. Yeah.
Right, yeah. Right. And then how did you then end up did you go directly from there to Washington, D.C.? Is that kind of how you progressed, or was there something in the interim?
No, I went right from Washington, D.C. I could tell you the guy who hooked me up was Joe Grogan. He was working with the president, and he was making opioids a big thing. So he was talking to me. And then it was weird. I never thought I would work in the government. I was just filling them in stuff that I know from both a treatment and using perspective, or a guy even in recovery, he worked in recovery. And then it was like, okay, well, I said, well, Joe wants your resume. And I didn't think much of it. Okay, sure. So, and then I remember it was like, I don't know, weeks, a month later, I didn't even remember about it. I got some weird looking emails like White House liaison or something, correspondence. And I thought it was junk. And I was almost going to delete it. And it was like some kind of, I told my wife, hey, look, some kind of White House sort of thing is coming through. And I thought, kind of grabbed the phone from me and said, no, that's them. I'm like, what do you mean that's them? I called the number and it was them. So I had to go. So I just like hit the lottery and got lucky with this. And I was very proud to come out and serve the president. And I started off at SAMHSA as a senior advisor. By the time I left, I was the deputy director at the White House Office of National Drug Control Policy. So I went from senior advisor at SAMHSA, and then I worked in the Domestic Policy Council as well.
You know, I think it's actually huge that someone with your background, you know, would be called up to work, you know, in policy at that level, because I think that so often, you know, we end up with clinicians who don't really have full-on reality of what it is to A, be addicted, and then B, be sober, and C, have worked with people who are addicted. So I think that's huge. What did you like about being in DC?
Well, I like the fact that I was actually, I mean, when I first walked into DC, I was like, I had like a lot of content knowledge, but then you got to learn, okay, now how does it work in the federal government, which was
Right.
different. I think, figuring all that out and some of the works, I feel like I had quite a bit of accomplishments, but I think I liked sort of being your hands on the policies, molding things going forward for the good of the country and doing your best that way, taking your insights, your knowledge, and that, and trying to produce something that would sort of help the average American citizen. I think I kind of really like that.
I think that's fabulous. I think that's huge. So I know you don't necessarily have an exact job that you're going to move into, but would you like to continue with being at that level and being able to do drug policy more, or would you like to go back and work with addicts?
Uh, uh,
Putting you on the spot.
I can kind of go sort of both ways.
Okay.
Right now, I'm talking to some people around the policy realm, and what I'm trying to do when I talk to people, if you look at it, now there's a number of reasons for it. I actually know what the biggest reason is, but when you look at people, if you look at just the data, that's SAMHSA's big survey they put out. I used to work at SAMHSA. Of the 20 million Americans who have like a substance use disorder, 89% of them don't get treatment, right? So I'm working and I'm talking with some people. Right now we're meeting other minds, we're trying to put something together. But how I ultimately want to do this and how I've been thinking about it is trying to create more of a better intervention strategy to where people actually get from point A to point B.
Okay.
Getting from active addiction into sort of treatment into recovery. So like narrowing that gap. And it could be, some of the, the homeless communities and on the West Coast or up there in Kensington, Philadelphia. I haven't gotten a chance to tour those yet, but I've been wanting to. But that's actually where I would sort of see, how do you actually kind of close and narrow that gap and move people from point A to point B. So
I think that's great. Art, if you could just, we feel that a lot of the people who listen to our podcast are friends and family of addicts, and maybe kind of don't know what to do or where to go. If you just had one message to give them, what would it be?
Well, a lot of times I would tell people, my traditional sign off, but keep the faith. So with your loved one, keep the faith. That's or just kind of sort of keep the faith. And then sometimes when I have to talk to them, I would kind of sometimes teach them a little bit the difference between enabling and helping and that sort of a thing. Enabling behaviors is more like, I had like a rule of thumb. If you're doing for the person what he should be doing for himself, and he's not because he's using, then you're sort of enabling the disease. You're not helping the guy. But if you're helping as far as putting down the groundwork, like maybe the first couple rents in a sober recovery house, or if you're helping somebody to start actually taking responsibility for their lives, I think you're actually sort of helping. And I would sometimes boil that down into the exact dynamics of a particular case. But I would always say start, like keep the faith. I mean, miracles do happen, and this is in recovery in and of itself is a miracle. So we are going to be moving in that direction.
I think that's great. And I think that's a great rule of thumb, that if you're doing something for the person that they should be doing for themselves, chances are you're just enabling them.
Right. And the light bill because he's spending this money on crack cocaine. You're not helping the guy.
Yep.
I'm sorry. Yep. People can refute that, but you're not.
No, I think it's good. I think it's good advice. Art, thank you so much for being willing to tell your story. And I'm super excited that you got to do what you did in Washington. And I know that you, as well as Katie, I know you guys are going to help to make a difference in this whole addiction pandemic. And, that's huge. So thank you so much.
Well, appreciate that. Yeah. Thank you for having that kind of faith. Yeah.
Absolutely. Thank you so much for listening. I specifically loved Art's whole story, Dr. Kleinschmidt's story about his own addiction. We had an interview with the pharmacist, and he talked about the pill mills in the New Orleans area. And obviously Art was very familiar with that. And now here is someone who, in spite of his own history with addiction, went on to work for the administration in Washington, D.C. And I feel that whatever he does going forward is going to be helpful to this whole addiction pandemic. And that's what we want, is we want to tell you that there's help available, that there are people working on this whole area. And also that for you personally, there is hope out there. There are so many different programs and so many different organizations that simply want to help you or your loved one get clean and sober. So thank you so much for listening, and we'll be back again next week with another interview.
You have been listening to the Addiction Podcast, Point of No Return, sponsored by Narconon Ojai. For more information on Narconon Ojai, call 866-231-5924 or visit www.narcononojai.org. Narconon is a non-12-step rehabilitation program based on the works of L. Ron Hubbard.